Good evening, everybody. I'm Mrs. K.Rani, Assistant Professor of Home Science, Sri Sharda College for Women, Salem. Today, we are going to see on the topic nutrition in pregnancy. Let us see the introduction. Adequate nutrition before and during pregnancy has greater potential for a long-term health impact than it does at any other time. Maternal health is a complex influenced by various genetic, social, economic factors and infections, including environmental conditions, many of which may affect the fetal growth. Physiological adaptations result in improved utilization of nutrients either through increased absorption, decreased excretion, or alterations in metabolism. Let us see the physiological changes during pregnancy. The total plasma volume in a non-pregnant woman averages 2,600 ml. In pregnancy, by 34 weeks, it is about 50% greater than it was at consumption. The blood volume expands by 50%, resulting in decreased hemoglobin levels, blood glucose values, serum level of albumin, which results in extracellular fluid accumulation, and other serum proteins are also decreased, including the water-soluble vitamins. By contrast, serum concentration of fat-soluble vitamins are increased. Let us see the importance of nutrition during pregnancy. Undernutrition of the mother preceding and during pregnancy affects the growing fetus in the womb. That is the main factor influencing pregnancy outcomes. An unhealthy diet rich in saturated fats, sodium and sugar, and poor in fiber, vitamin, and minerals impair the metabolic profile, increasing oxidative stress and insulin resistance, and consequently increasing the fat and glucose transfer to the fetus. Increasing in nutritional requirement is due to metabolic changes of pregnancy and nutrition reserves of the mother. Let us see the nutritional requirement by the ICMR. Let us see the energy requirement. For a sedentary worker, the calorie requirement for a day is 1,660 for the normal women, and for a moderate worker is 2,130, and for heavy worker 2,720 calories. So these values are for normal women. But during pregnancy, additional kilocalories has been recommended by the ICMR, that is 350 calories. Whatever the activity may be performing, additional allowance of 350 calories is provided for the pregnant women. The reason for the increased calorie is for the growth and physical activity of the fetus, growth of the placenta and maternal tissue, normal increase in maternal body size and deposition of fat, additional work in carrying the weight of the fetus and extra maternal tissues, slow but steady rise in the metabolic rate during pregnancy, and the total weight gain, normal weight gain during the pregnancy is 10 to 12 kgs. Let us see the protein requirement. For a normal adult woman, the requirement is 46 grams per day. But for the pregnancy women, during the second and third trimester, additional protein requirement is needed, and the value is 9.5 grams for the second trimester, and additional amount of protein, that is 22 grams per day, is provided for the pregnant women. So the increase in protein requirement is needed for the rapid growth of the fetus, enlargement of the uterus, mammary glands, and placenta, increase in maternal circulating blood volume, and subsequent demand of increased plasma protein to maintain colloidal osmotic pressure and circulation of tissue fluids. Increased amount of protein is also needed for the formation of amniotic fluid and storage reserves for labor, delivery, and lactation. And also, additional amount of protein is needed for the transfer of amino acids from the mother to the fetus. If that additional amount is not met by the pregnancy mother, means there will be increased risk of pregnancy and the fetus may grow at the expense of mother. Let us see the protein-rich foods. Milk, meat, egg, cheese are the complete proteins and of high biological value. Pregnant women requires 600 ml of milk per day. Protein cereal intake ratio should be 1:5 and protein supplements are not required if adequate amount of protein is provided in their daily diet. Let us see the visible fat and essential fatty acids. Omega-3 fatty acids are required for normal conception, growth, and development of an embryo. The minimum level of total fat should be 20% of energy. 30 grams of visible fat is provided during the pregnancy period, and the pregnant women should consume at least 200 milligrams of DHA per day. During the third trimester, 50 to 60 milligram of DHA, that is maternal DHA stores, are transferred to the fetus via the placenta, and this DHA plays a critical role in both vision and cognitive function activity, that is the keenness, whether it is hearing or whatever the thing, seeing, everything, the DHA plays an important role in the brain development. Increased intake of omega-3 fatty acids should be encouraged for pregnant and lactating mothers for optimal health of the infant. Let us see the sources of essential fatty acid. Corn, cottonseed, safflower, and soybean oil are good source of linoleic acid. And alpha-linolenic acid is present not only in fish but also found in green leafy vegetables, flax seeds, rapeseed, soybean, and walnuts. Let us move on to the calcium requirement. The calcium requirement suggested by the ICMR for an adult woman is 1000 milligram per day. Increased intake of calcium by the mother is highly essential not only for the calcification of the fetal bones and teeth, but also for production of calcium resources of the mother to meet the high demand during lactation. The pregnant woman routinely exhibits extensive adjustments in calcium metabolism, largely as a result of influence of hormonal factors. Physical activity also influences the bone density of the mother. To prevent osteomalacia, the diet should be less than phytic acid and sufficient amount of vitamin D in mother's diet. A rich source of calcium. Dairy products are the primary source of calcium. Green leafy vegetables like agati and gingerly seeds also contribute to calcium increased intake. Next, we can see the iron requirement. Iron is also required for the formation of hemoglobin, as there is 40 to 50% increased maternal blood volume. For this, 400 milligrams of iron is required. Loss of maternal iron through the skin and sweat is about 170 milligram of iron. Iron requirement in the first trimester is similar to the normal requirement, but during the second and the third trimester, the daily additional requirement of iron is 3.3 milligram, that is in the second trimester, and for the third trimester, 5 milligrams respectively. And rich source of iron are liver, dried beans, dried fruits, green leafy vegetables, eggs, enriched cereals, and iron fortified salts provide an additional sources of iron to the pregnant women. And let us move on to the fat soluble vitamins. Vitamin A. A daily supplementation of 6,000 international units for about 12 weeks appears to improve the serum vitamin A levels and correct the vitamin A deficiency in the pregnant women. Improving vitamin A status of pregnant women reduces maternal mortality. Liver, egg yolk, butter, dark green vegetables, and yellow vegetables and fruits are good sources of vitamin A. And let us see the requirement of vitamin D as prescribed by the ICMR in 2020 is 600 international unit. Vitamin D is highly essential as it enhances the maternal calcium absorption. Its active form of calcidiol and calcitriol cross the placenta with ease and play an important role in calcium metabolism of the fetus. Maternal deficiency of vitamin D results in neonatal hypocalcemia and hypoplasia. Research suggests an association between vitamin D status and pregnancy complications such as preeclampsia, gestational diabetes, and risk of cesarean section also. Low maternal vitamin D status may impact the offspring, the length of gestation, and potentially the fetal growth also. And let us move on to the requirement of vitamin E in animals. The vitamin E has an important role to play in the reproductive process and reduces the number of spontaneous abortions and stillbirths. In women, it has not been evidently proved that vitamin E deficiency can cause pregnancy failure, although it may prove beneficial to those who have repeated spontaneous abortion or failure to conceive. The requirement of vitamin E increases with increased intake of polyunsaturated fatty acids, which is also known as PUFA. Then coming to vitamin K, vitamin K is essential for the synthesis of prothrombin that is necessary for the normal coagulation of blood. It is highly essential for preventing neonatal hemorrhage. An oral dose of menadione, the synthetic form of vitamin K, during the last weeks of pregnancy or an injection during labor is essential to stimulate prothrombin synthesis. But care should be taken to see that dosage is given at an average level to prevent adverse effects. And let us see the water-soluble vitamins one by one. First is thiamine, that is B1. The ICMR recommendations in 2020 for the thiamine for a pregnant woman is 2 milligrams. The relationship between the thiamine and the calorie intake is the same as the normal adult and during pregnancy for every 1000 calories, 0.5 milligrams of thiamine is required. In some cases, thiamine helps to relieve the nausea of pregnancy. Riboflavin, the ICMR recommendations of riboflavin for a pregnant woman is 2.7 milligram. For every 1000 calorie intake, 0.6 milligram of riboflavin is required, and the requirements are increased due to the increase in maternal body size and growth of the fetus and accessory tissues. Riboflavin is present in higher amounts in the fetal blood than in the maternal blood. And these are the foods which are rich in B2, that is riboflavin. And niacin, the RDA for niacin based on the activity, that is 11 milligrams for sedentary, 14 milligrams for moderate, and 18 milligrams of heavy worker per day. In pregnant women, the RDA has been increased by 2 milligrams, corresponding to the increase in calories. The conversion of amino acid tryptophan into niacin more efficient during pregnancy. And let us see about the B6. The requirement for the normal is the ranging from 1.9 to 2.4, but during pregnancy, this has been increased to 2.3 milligrams per day. The vitamin B6 is said to be used to control nausea of pregnancy, egg, banana, avocado, spinach, chickpea, liver, beef, milk, etc. are good sources of vitamin B6. Next, we can see about the dietary folate. Folic acid is needed for the synthesis of essential components of DNA and RNA, which increase rapidly during the growth, thereby increasing the requirements. Also, folic acid is essential for the development of RBCs, which increase as the mother's blood volume increases. Folic acid deficiency can lead to anencephaly, that is the absence of brain. And folic acid deficiency has been implicated in pregnancy-induced hypertension also. Rich sources of dietary folate or green leafy vegetable like groundnut leaves, tamarind leaves, and legumes like moth bean, red gram, rajma, and soybeans. They are the good sources of folic acid. And nuts, especially groundnuts, vegetables, root vegetables, plus green vegetables like lady's finger, capsicum, and fruits like mango also contribute folic acid. The diet for the pregnant women should contain all these foods. And next, we can see vitamin B12. Adult women's requirement of B12 is 2.2 microgram, and this requirement is increased by 0.25 microgram during pregnancy. The fetal blood has twice the amount of B12 than does the maternal blood, even when the maternal levels are depleted. Low maternal levels are associated with the prematurity. All the foods from the animal origin contain B12, and B12 is not present from plant origin. And next we can see vitamin C. The ICMR recommendation of vitamin C during pregnancy is 15 milligrams, higher than that of the normal women recommend, which is 65 milligrams. The fetal requirement is too small, and sufficient safety margin is given for an adult woman, and extra allowance may not be necessary during pregnancy. And these are the nutritional requirements that has been suggested by the ICMR RDA for the pregnant women. We can conclude our class now. Thank you very much for your patience listening. Thank you. Once again.